Thanks a lot for this interesting presentation. Now, given that Professor Borchardt is the only speaker of this session, the talk is open for discussion. Are there any questions?
I never had a session of my own.
Yeah.
Well, it was a nice overview of the field and your specific result as well. But I think we're really in a new era now for all the regulatory agency and for us as a scientist. Because the nanomedicine are really something totally new. They are not, or the nanodrugs, they are not like you take a small drug and try to imply for it what will happen to your assembly. Because once you're dealing with supramolecular assembly, all the rules of the game are changed. You get to different places at a different time. Sometimes the drug is released, sometimes the drug is not released. So the complex itself, or whatever, is really your new drug. And that's why nanodrug is a much better name than any other name you have. The problem is that saying that, you know, physical-chemical parameters that you have are not enough is really, what's behind it is that we really don't know what are the physical-chemical parameters we need. If you look now at the FDA, what the FDA did with generic Doxil, really fantastic job, I have to say. You look at all the details they request on the physical-chemical term, and later you translate it into biology, you will find that if you are really in what they defined as generic, it really behaves the same. Now, the problem with these iron particles, which I'm not very familiar with, but what I'm familiar with, and I was in few meetings talking about that we don't know what to ask. So we don't know what are all the physical-chemical parameters we need in order to say that we have a similar. So basically, you say number one is the original, number two is the similar. It's not really a similar, and that's why it behaves differently. We have to understand better what is the similarity there.
Yes. Josie, thank you very much for confirming what I tried to present. What I'm rather optimistic about is, especially for the Doxil, first of all, for the Doxil, you never know. You never know whether it behaves the same or not. So what you said is we have to ask the right questions and do the right characterizations. Secondly, I'm rather optimistic because the tide is changing, and also the mindset at EMA, at FDA, and also at the EDQM is more like towards what you said, and what I tried to express is that to look at this differently than for other small molecular weight drugs. However, having said that, we must not forget that some of these drugs are actually on the market, and without a proper, in my view, a proper regulatory approach to put them on the market, and that's the problem right now.
So they shouldn't be on the market?
That's you who said that.
No, if they are not safe and you have problems, why to put them on the market?
Okay, Professor Clark.
Hepatitis B virus and hepatitis C virus enter liver cells through tight junction proteins. They use claudin, for example, as an entry point to get into liver cells. And in order to see those proteins, they need to disrupt the barrier. And pro-inflammatory cytokines like TNF assist in that. They break down the epithelial barrier and allow the HCV to enter the liver cells. So I was really interested to see what the TLR2 agonists are doing in your system. And I wonder if you have ever looked at the effect of TLR2 agonists on liver cells and whether they might be a way of preventing viral transmission in the liver.
We haven't looked at liver cells, but that's a good suggestion. We should talk later. Thank you.
The question up there?
So, here.
Oh, yes.
One point that I kind of miss in your presentation is the half-life of the nanoparticles, and especially when you want to interfere with the immune system. And I say this because there are approaches also to target to some particular cells, APCs, and also because there are many people using these approaches to put antigens in nanoparticles to send them to the liver, that is usually when they are clear, and also to do the opposite effects. So how do you think is good to have an active target principle to go to the right cell, and what is about the half-life in general?
You know, what we're doing is mucosal vaccination there. So we go to the mucosa and we try to get it to the right cells. We have some data on how these particles are actually sampled from the bronchial epithelium. There's these dendritic cells reaching through the tight junctions and sampling at the other side of the epithelium. I am not so sure about targeting, I must say. We worked a little bit in this, but we did not see too many very nice results there. Whereas if we present our particles to the epithelium, we see good immune responses and take up of these particles by the macrophages or dendritic cells. So I'm a little skeptical when it comes to mucosal immunization. And what you said about residence time or time in the body, yeah, of course. That's a problem which you have to look at how long the body is actually exposed to the nanoparticles. Talking about the TLR2 again, we need some time in order to see these effects at all, because the TLR2 obviously in the epithelium are first recruited to the surface of this epithelium, and that takes some time. So yes, time is of the essence.
So, right here. Great talk. The question, a short preface and the question. All of the toll-like receptors have evolved to be attacked or have been attacked or to react to a specific organism that has evolved. And as we put these materials in, and I'll go back to one of your slides where you used 200 milliliters of one of the similars that actually showed a higher immune response, has anyone or have you looked at the combination activation of multiple toll-like receptors for different things? You get a combination LPS, fungi, toll-like receptor where you get a partial activation of one and a full activation of another. Because as we look at some of the viruses and things like this, and some of the particles, as you know, the radius of the particle is critical for either the endocytosis or not to have it endocytose. Mm-hmm. And I was wondering whether or not you have actually looked at this in these longer particles to see whether or not you're getting a partial activation of one and a full activation of another, or a partial activation of multiples.
So these are two things mixed a little. So the application of the iron sucrose there was at a clinical stage, not done by us. It only shows that if you do a dilution of these nanomedicines, you change a whole lot of parameters. For instance, the iron, the labile iron released from these particles plays an issue. And I don't think this has anything to do with the toll-like receptors there. By contrast, the second part of your question was like, yes, that's what we're trying to do. We try to stimulate the immune system by two pathways, and I think I showed the activation by the NOT2. In our case, in the case we used the stuff and we formulated the stuff, had some contribution to a certain percentage. So it's halfway up regulated, or whatever you want to call it. But yes, and this is not only us, but a lot of people who are looking into this. I think I have to stop.
Here at the very edge. Oh. So Jan Monhauer, University of Southern Denmark. Enhancement or restoration of tight junction function would also be pretty interesting for IBD therapy and cancer therapy. Have you been thinking about that or activities in that area?
Yes.
Which cancer types?
We can talk later.
Okay, if there are no more questions, then let's terminate this one-man session. And